apart from pathophysiology and BPPV and vestibular neuritis, the difference between the two. So we're comparing and contrasting BPPV and vestibular neuritis. So in BPPV, the vertigo is provoked by head positional changes. Otherwise, it is not provoked, right? So it's not there. The pattern of nystagmus is quite characteristic in BPPV, so upbeating and torsional or horizontal nystagmus. And it's short-lived, usually less than a minute, oftentimes less than 1 or 2 minutes, occasionally over a minute, but usually less than a minute. And in BPPV, you will get attacks that go on. It can go into spontaneous remission whenever you want, but we'll have attacks that will go on frequently for many weeks before it eventually either is treated or kind of goes into spontaneous remission. In neuritis, you have a much more intense presentation. So the patient experiences the vertigo. The vertigo goes on in a nonstop manner for sometimes hours or days. If they move their head around, it makes it a lot worse. But just lying there, they're still experiencing the vertigo. In other words, it's not provoked by head positional changes. The vertigo and the nystagmus is much more sustained than BPPV, and the pattern is completely different. So what happens in vestibular neuritis, you end up with, for example, in our patient with the right foot neuritis, we had left beating nystagmus. There actually is even a torsional component to it as well. Whereas in BPPV, it's usually vertical nystagmus with torsion. And if you do have horizontal canal BPPV, then you get horizontal nystagmus with no torsion. So it looks very different. The nystagmus is going on nonstop in room light as the patient is just lying there. So think of a neuritis as being a much more severe, sustained episode of vertigo and nystagmus, nausea, vomiting potentially. Whereas BPPV is a much shorter duration, not quite as intense, and only provoked by head positional changes. It looks a little bit different. So hopefully I know it's a complicated answer, but I thought it might be wise to stop and kind of discuss that, because it is important to kind of have a sense of the difference between the two. Also, I guess the other piece I could bring in here would be that neuritis, it's very unusual to see sequential neuritis. So if a patient says to me or to you, I've had 6 episodes of vertigo when I get into bed. Every time I get into bed, I get vertigo for a minute or two. Very different. That would not be a neuritis. So because after you've had a neuritis, you really don't have an increased risk of a second one. So the risk drops back down to if you never had it the first time. And so you don't see multiple attacks of neuritis over a period of time. That just doesn't happen clinically. Good, thank you. Very good question.